Ever found an old medication bottle in your cabinet, looked at the expiry date, and wondered, is this still good? It is a common question, and one we need to answer carefully when managing our healing journey. When it comes to medications, the expiration date printed on the label is a critical guideline. It represents the date until which the manufacturer guarantees the full potency, safety, and stability of the drug when stored correctly. Beyond this date, the medication cannot be guaranteed to work as intended, and in some cases, it could potentially be less effective or even harmful. The why behind these dates is all about chemistry and medicine. Over time, the active ingredients in medications can break down or change their chemical composition. This degradation can lead to a decrease in the drug's strength, meaning you might not get the full therapeutic effect you need. For critical medications, like those for heart conditions or serious infections, this reduced potency could have serious health consequences. Also, some medications can even develop toxic compounds as they degrade. Although this is rare, it is an important safety consideration. So, what should you do? Always check the expiry date before taking any medication. Store your medications properly, usually in a cool, dry place away from direct sunlight, not in a humid bathroom cabinet. For most non-critical medications like pain relievers for mild discomfort, if they are just a few months past their date, they might retain some potency, but it is always best to replace them. However, for any life-saving or essential medications, such as insulin, nitroglycerin, or antibiotics, it is crucial to adhere strictly to the expiration date. Using these past their prime is a risk not worth taking. You might have heard about a military study, the Shelf Life Extension Program, or SLEP, that tested the potency of various medications past their expiry dates. This program found that many drugs, when stored under ideal conditions, retain their potency 4 years beyond their printed dates. However, this is a highly controlled program for very specific medications and storage conditions, not for general consumer use. It highlights that while some stability might remain, without precise knowledge of storage and chemical analysis, we cannot assume our home medications are as stable. The manufacturer's date is our best and safest guide. Understanding medication expiration dates empowers you to make safe and effective choices for your health, especially during your recovery. Relying on properly dated medications ensures you receive the full benefit of your treatment, preventing complications and supporting your healing process with confidence. Always prioritize your safety and peace of mind by respecting those dates.